Good afternoon. My name is Michelle Matter, and I'm the Director of Aging for SDSU CEAL, the Center for Excellence in Aging and Longevity. Today I'm excited to discuss our work supporting caregivers through community connections. As a family caregiver myself, this work is both personally and professionally rewarding. I truly understand the challenges and rewards that come with this role, and I'm excited to share how we are building community networks that make a meaningful difference in the lives of caregivers. I wanted to share a little bit about CEAL. We are dedicated to addressing the current and emerging challenges of healthy aging. Through our innovative programs and research, we work to enhance the quality of life for individuals across the lifespan. We focus on several key areas to drive our mission forward. We explore innovative approaches to support healthy aging, ensuring individuals can thrive at every stage of life, such as this event today, which is part of our Healthy Longevity webinar series. We collaborate with communities to create age-friendly environments that support the needs of older adults. We advocate for policies that improve the lives of older adults and caregivers, and we conduct research to better understand the challenges and opportunities of aging. And the reason we are here today, we work to enhance and diversify the direct care workforce, equipping caregivers with the skills and support needed to meet the growing demands of aging populations. Before we talk about our work, I want to recognize that November is Family Caregiver Month. I mentioned I'm a family caregiver, along with 53 million other people across the United States, who provide over $600 billion in unpaid care. More than half of family caregivers are also managing full-time jobs while providing care, and I know firsthand how difficult it can be to balance caregiving with work, with other responsibilities like raising children or volunteering. My mom has a progressive disease, and over the last few years, she has lost her mobility and her ability to communicate effectively. Despite my experience in the field, I've often felt isolated in my role, and I'm not alone in feeling this way. Nearly half of caregivers aren't receiving any financial support, counseling, or respite care, but 88% of caregivers say they need more help. There's also a growing demand for professional caregivers. Over the next decade, we'll need to fill about 9.3 million direct care jobs. Just think about how much higher that number would be if family caregivers weren't stepping in to help. But here's the challenge. Retaining direct care workers is a huge issue. More than 21% of them leave the field every year. And it doesn't just disrupt the care that people rely on, it puts even more pressures on the workers who remain, and they are already stretched thin. To keep up with this growing need, we have to do more. We need to invest in better support, training, and resources for caregivers to ensure that they're equipped to provide the best care without burning out. I want to share our solution. With the support of 2 state grants, Cal Grows from the California Department of Aging and Caring for Cal from the California Department of Healthcare Access and Information, we launched the San Diego Caregiver Connections program. The goals are to increase and diversify the direct care workforce and support friend and family caregivers through comprehensive training, peer support, and career pathways. And I'm excited to share in the first year of the program, we had over 6,000 participants who completed over 62,000 hours of training. We wanted diverse participation in the program, and we worked with community partners to spread awareness to low-income and under-resourced communities who often lack access to training opportunities, especially training in multiple languages. And I'm proud to say that 81% of our participants identified as people of color. The average age was 43, meaning many participants were probably part of the sandwich generation, taking care of both children and older family members at the same time. And 25% of participants spoke multiple languages. Our community partners were instrumental in the success of our program. Stepping Higher is a faith-based organization, and they helped us reach our target population through a variety of ways, including word of mouth, email, and social media. We found that many people who were providing care didn't view themselves as caregivers, just simply helping family members, and therefore weren't taking advantage of available resources. We have a great partnership with the County of San Diego IHSS Public Authority, who provided in-person training opportunities for caregivers. We also referred participants of the program who were looking for work to become in-home supportive service caregivers through the county. We worked with Determine Health and the Glenner Center, who provided subject matter expertise in dementia care, community health, and care transformation. We also worked with Grossmont Healthcare District to increase outreach in rural areas and among students interested in the healthcare field. We had several high school students who completed caregiver training. Just like people who are working and providing care, there are more than 1.6 million caregivers in the United States aged 15 to 18. And we recently highlighted one student on our LinkedIn who's providing care to her grandparents. She wrote about her experience in her college application essay and her advocacy to support other student caregivers. And I'm really proud of our collaboration with the United Women of East Africa. They help facilitate in-person training in 4 different languages or dialects to nearly 250 refugees who are caregivers or interested in working in direct care. I'd like to share some of the caregiver training courses we offer. We have over 80 hours of training available, with 30 hours completely in Spanish, and many of our courses come with subtitles in 4 other languages, covering a wide range of important topics. For those just starting out, we've got some great introductory courses, things like understanding nutrition, recognizing burnout, and improving communication skills. For those looking for more in-depth learning, we offer advanced training on topics like providing care for LGBT older adults, overcoming barriers to care, and understanding mental health challenges like anxiety and hoarding disorder. These courses dive into the unique challenges caregivers face in these situations. Our end-of-life courses have been the most popular. These courses focus on the emotional experiences that older adults face at the end of life and provide coping strategies for both family caregivers and direct care workers to manage stress, burnout, and trauma. We know these are tough topics, but the training really does help. We've heard from participants that it's really helped deal with a difficult time in their life. We also offer nearly 40 hours of dementia-specific training. Many of these classes are led by Teepa Snow, an expert who teaches family and direct care workers a positive approach to dementia care. It's an incredible resource for anyone supporting individuals with dementia. You can register for any of these courses on our website, and the best part is there's no cost for participants. And while training is absolutely critical to equip caregivers with the knowledge and skills that they need, we quickly realized that education alone wasn't enough. Caregivers face emotional and social challenges that go beyond what training can address, and they truly need a support system. And that's why we introduced a peer-to-peer support component to our program. I'm going to hand it over to my colleague Fernando, who's going to share more about our peer support program and how it helps caregivers thrive.
Thank you, Michelle. My name is Fernando Reyes, and I manage our peer support program. And the peer support program allows caregivers to connect with others who are experiencing similar challenges, creating a safe space to share stories, offer advice, and provide emotional support. Our evidence-based program was designed around peer support models used in behavioral health. Over the past year, we've learned there's no one-size-fits-all solution for developing a peer support program. Models must be adaptable, flexible, and offer personalized approaches to meet participants' needs, which may include online or in-person, as an example. When we first developed this program, we thought it would mainly be friends and family caregivers who were typically isolated in their work. But we ended up being more paid direct caregivers who needed additional support. Peer support programs offer a variety of benefits that go beyond just providing a space for shared experiences. One of the most significant advantages is stress reduction and burnout prevention. By connecting with others who understand the challenges caregivers face, individuals can share their struggles and receive the emotional support they need to alleviate stress and reduce burnout. Additionally, peer support facilitates knowledge sharing and skill development, where caregivers exchange practical techniques, resources, and referrals that enhance their caregiver abilities. Participating in these programs has also been linked to improved job satisfaction, where caregivers feel supported and valued. They are more likely to find fulfillment in their roles, which ultimately leads to higher retention rates within organizations. Another key benefit is the enhanced communication and collaboration amongst caregivers. Peer support encourages open communication, resulting in better teamwork and more cohesive care plans. And perhaps most importantly, peer support can reduce turnover. By offering both emotional and practical support, these programs create a more stable workforce, which is crucial for delivering consistent, high-quality care. And lastly, studies show that caregivers who participate in peer support report better health outcomes, including lower levels of depression and anxiety, improved physical health, and an overall greater sense of well-being. I wanted to share what we've learned offering peer support over the past year. One aspect is that people love sharing their unique experiences, not just their struggles or some of those negative experiences that they've had, but also a lot of times they're positive experiences, times where they've been able to give them opportunity to celebrate a good achievement. Maybe perhaps it was helping somebody help them, that they are able to brush their teeth by themselves, and increase the independence to those they're providing care. So those celebrations are also just as important as many of the struggles that they face and deal with. Our surveys also show reduced isolation by participating at least once a month. Again, this is an opportunity for caregivers to feel a sense of community because they can relate to one another. There were unexpected opportunities for practical advice. For example, we had a hospice nurse join one of our peer support groups, and she provided a lot of information on what hospice involved, cleared up a lot of the misconceptions, and it was really beneficial not only to myself but to many in the group as to what, again, hospice was. We had a better understanding and a bit of appreciation of what she did. And we also have had guest speakers to provide information on referrals, for example, education on adults aging into disabilities and the resources available to them. And we've had several people connect through peer support who shared they provided respite care for one another. And we've had multiple examples of people who've shared that they've become friends through this experience. And so we've been glad to see that the peer support meetings has allowed others to connect with one another as they go through the experience as a caregiver. If you're interested in learning more about our experience with peer support, we've developed an issue brief that highlights best practices we've learned from both research and our own experience. This is on our website, but I want to highlight a few best practices which come from both research and our experience. Recognizing your role, oftentimes we may want to be a counselor or serve in some additional capacity, but know that we need to stay within our roles either as a participant or facilitator. Providing effective communication, setting clear boundaries, our shared experience as caregivers. We know many of the highs and lows associated for being a caregiver, so we're able to really relate to one another. Being able to, again, provide resources and referrals, structured training, integration of technology, collaboration with professionals, and promotion of self-care. As caregivers, we know this role is really stressful. So we want to make sure that we are taking care of ourselves in order to be able to provide the best care for our loved ones and those we are providing care to. Our issue brief also includes a comprehensive framework for caregivers peer support, which covers key areas such as purpose, guidelines, community building, DEI, as well as feedback and evaluation. An important part of this framework is the emphasis on evaluation, which allows us to continuously assess whether we are providing the right resources, training, and support. By using a person-centered approach, we can better tailor our support to individuals' unique needs and experiences, making sure our programs are both effective and relevant. We recently completed a first-year evaluation of our program, which provides valuable insight into how we're doing and where we can improve. I'm going to turn over to Michelle now to share some of the results of our program evaluation.
Thank you, Fernando. We are excited to share the outcomes of our program evaluation. We saw a significant increase in preparedness among participants to handle their caregiving responsibilities. Before the training, the average preparedness score was 4 out of 10, and after completing the training, that rose to 8 out of 10. 91% of participants reported improvements in their caregiving skills and knowledge, showing that the program is effectively equipping caregivers with the tools that they need. And 86% of participants felt more prepared to manage their caregiving duties, which speaks to the value of the support and training provided. Additionally, overall satisfaction with the program was high. 86% of family caregivers and 81% of paid direct care workers expressed satisfaction. These positive results demonstrate the success of the program in supporting both family and professional caregivers. We conducted interviews with 45 individuals who engaged in peer support for a minimum of 4 weeks and completed 30 hours of training. All participants identified at least one benefit of peer support, including the opportunity to share experiences, access to resource and advice, and alleviating feelings of isolation. One of the stats that we are most proud of is 100% of participants expressed that they would recommend the peer support program to other caregivers. We really believe this shows the positive impact of both peer support and training. As we look to grow and enhance the program, the survey findings also highlighted areas where we can improve. Nearly a quarter of participants reported challenges balancing caregiver responsibilities with attending peer support sessions. This suggests the need for more alternative formats to accommodate availability of caregivers, such as evenings, weekends, or more virtual formats. Flexibility is crucial for caregivers who are juggling multiple responsibilities. Participants also expressed a strong interest in more advanced training, specifically more disease-specific caregiving challenges. Addressing these requests will allow us to provide a deeper, more targeted education that can significantly enhance the care provided with specific conditions such as Alzheimer's, Parkinson's, or other chronic illnesses. Another significant area of interest was hands-on training. Participants wanted practical skills they could apply directly in their roles. Practical experiential learning opportunities can be incredibly beneficial, enabling caregivers to practice and refine their skills in a supportive environment. And then a small group of participants noted that they wanted additional career pathways opportunities in the direct care field. We have an opportunity to support caregivers not only in their current roles, but offer career development resources and training for career advancement to see the sector open up to new professional pathways and increase job satisfaction. To conclude, I want to share a powerful quote by former First Lady Rosalynn Carter. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. This quote reminds us that it's an experience that touches everyone, directly or indirectly. I never expected to be a caregiver for my mom in her late 60s. It's a role that came unexpectedly, bringing both challenges and a deep appreciation for those who provide care to others. Whether we find ourselves providing care or receiving it, there is a need for compassion, support, and understanding. Thank you for participating in today's webinar. If you'd like more information on San Diego Caregiver Connections, I encourage you to visit our website, CEAL.sdsu.edu. Feel free to email us with any questions you may have, and I also encourage you to follow us on LinkedIn to stay updated on our work, including our next Healthy Longevity webinar. Thank you so much, and I hope you have a good evening.